Good afternoon, and welcome to my presentation on community and public health. My name is William Massey, and this is the final. Some things we're going to talk about today with community and public health is the role of community and public health in the well-being of the populations. We're going to also discuss public health organizational structure, legal and ethical dimensions of public health, funding of public and community health services, and the role of communication in community and public health programs. First off, we're going to talk about well-being, the role of community and public health. Public health is a critical part of the larger concept of health systems and has been defined as what we as a society do collectively to assure the conditions in which people can be healthy. We do that with things such as education. We educate our loved ones and our people in our society on the dangers and hazards of living unhealthy lifestyles, the potentials of smoking, what smoking can do in the long term, what eating a lot of fatty foods can do, what drinking a lot of sodas can do, what leading a sedentary lifestyle can do. They encourage you to get up, be active at least 30 minutes a day with an elevated heart rate. All sorts of different types of education is provided. Next is accessibility. What good is education if people can't get to it? So we need to make sure that this education, this knowledge is accessible to everyone. We don't want just certain people to have privileged information. We want to make sure the person at the bottom of the pole gets the same information that the person at the top of the mountain gets. With that, equality. Equality can go kind of hand in hand with accessibility. Equality for everyone, not the rich or the poor. Everyone should be able to get the same information. They should all know the hazards of living unhealthy lifestyles, what they can do to be healthier, where they can go to get the information. It should be equal for every person. Programs and policies. Programs and policies are in effect to ensure that we do, to the best of our abilities, provide healthy living for everyone in our society. We have healthy lunches for our children. We have the Play 60, the government and the NFL have set up to have teach our kids that 60 minutes a day of activity will get them in a groove of something that is fun, they're active, and it will give them the ability, the drive as they get older to continue leading a healthier lifestyle. They get them out and about and not at home playing video games, eating potato chips. Standards. We got to have standards for our health. We need to tell people what is healthy so they can have a goal. So we need to set standards as to what is healthy. Everything with our food intake, with the amount of exercise, everything has a standard. So obviously you're not gonna eat a bunch of fatty food and not exercise. You have to balance that. That's why they set standards. You should do this amount of exercise if you want to burn off, this many calories. And the same with just health codes, health in general, stair railings being required on all public stairways. And then the assurance. Society needs to know that we have their best interest at heart. The goal of public health is to improve health outcomes for populations through the achievement of objectives of preventing diseases and health consequences of environmental hazards and natural or man-made disasters, promoting behaviors that reduce the risk of communicable and non-communicable diseases and injuries, and ensuring the public's access to quality health services. Next, we're going to talk about public health organizational structure. Here we have a few of the different types of public health organizations. We have the CDC, the Center for Disease Control and Prevention, the United States Department of Health and Human Services, and the Food and Drug Administration. The Center for Disease Control and Prevention is responsible for maintaining, recording, and analyzing disease trends of all types of diseases, including communicable diseases and diseases resulting from lifestyle, occupational, and environmental causes. The CDC also publishes reports on all these diseases, including the Morbidity and Mortality Weekly Report, which reports updated incidence and prevalence statistics for a number of reported diseases. What the CDC is ultimately doing is keeping us aware of any new diseases, any new outbreaks, or issues resulting from diseases. I know a week or so ago there was a problem at the CDC with anthrax. We saw that on the news. Next is the United States Department of Health and Human Services. Work carried on by the Health and Human Services Department falls into three categories: provision of direct services to specific groups within the overall population, gathering and disseminating technical information vital to the maintenance of optimal public health and safety standards within the United States, and support for specific research that can contribute to the same health-related goals. So what the Health and Human Services is doing is they're maintaining our standards. They're keeping a lookout for new policies, new treatments that could potentially help our population be healthier. The Food and Drug Administration. The Food and Drug Administration is a part of the Health and Human Services. The mission of the FDA is to protect the nation's health. Consequently, the U.S. Congress empowered the agency to prevent the sale of harmful products. The FDA's specific duty to enforce the numerous federal laws that have been passed to ensure that foods and drugs are pure and safe, and that all such products are correctly labeled. We see that with a lot of items, supplements, medications. They're waiting for FDA approval to be able to sell legally. I know there's been controversy in the past that there are drugs that help with certain issues that the FDA hasn't approved yet, so people are going to other countries for those drugs or for those treatments. Like I said, the FDA is here to ensure our safety and keep our best interests at heart. Next is the legal and ethical dimensions. The government is responsible for keeping us safe. That's why we have the programs, the CDC, the Health and Human Services, the FDA. They have these to, like I said, keep our best interests in mind. That is why we have laws and rules to follow. We have laws, the seatbelt law, that not only protects you, but that protects everybody else around you. Say you were in an accident and you became a projectile, that you are not going to injure people because you are safely restrained in your vehicle. Mandatory vaccination, seatbelt laws, like I just discussed, railings on stairwells I had talked about earlier. I know in the past we've discussed the mandatory vaccinations and being told that you have to take these. Certain vaccinations aren't just to protect you, it's to protect those people around you as well. Laws can intervene at various levels to help promote the healthier population. Ethics. Professionals act for common welfare. Ethics is the trust society bestows on public health professionals to act for the common welfare of society. I think that's walking a fine line. We put a lot of trust in our doctors. Our doctors also make a lot of money by the procedures that they perform. But they have the ethical dilemma of doing what's right, providing the care that is needed, making sure that the stuff they are doing is necessary and in our best interest. Like I said, there are times where you can see where the doctors are trying to do what's right for you versus just trying to make extra money, knowing that if they run this X-ray, they may get paid a couple more dollars when the X-ray may not have been needed. The funding of public and community health services. First, we have capitation. Capitation, a system where the funder reimburses the provider based on a set cost for the population. Capitation is used in some grant-funded programs. Capitation is used to control the costs of healthcare. A fixed amount of money per patient is given to the physicians. So the physicians, again, this is where it keeps them in line, but then they also could be at financial risk if there's a procedure that is required that they may have to come out of pocket for that patient, but on other patients they should make their money on. Next is managed care, a program service providing coordination, utilization, and cost containment for a group of designated clients. Pretty much managed care plans are contracts with healthcare providers and medical facilities to provide care at reduced costs. Health insurance, we're all aware of health insurance. People have jobs that offer health insurance and they're covered. They pay their premiums. Sometimes they have a copay. Next, the Affordable Care Act, once known as Obamacare. It has provided insurance for 30 million people who were previously uninsured. And its objective is to make healthcare affordable for everyone. Unfortunately, that may not always be the case. Certain people's premiums have gone up and their healthcare quality of their healthcare may have gone down. That takes us to communication in the community and public health programs. Again, like we said earlier, communication is critical, and that goes hand in hand with education. We need to communicate with our people. We need to have our children aware of the risks of leading unhealthy lifestyles or going down the wrong paths. Education goes with that. It starts in our schools. If we teach them young, it will carry over into their adult lives and on into their later lives. And hopefully it promotes longevity amongst our society. With that brings us to our summary. We talked about the role of the community in public health and the well-being of our populations, education, equality. Everyone deserves the right to live a healthy life. Public health organizational structure, we talked about the CDC, the FDA, and the Department of Health and Human Services. We talked about the legal and ethical issues that might come up with doctors. We talked about how these programs might be funded with health insurance and the Affordable Care Act and capitation. And then we also talked about the role communication in the community and public health programs. I thank you for your time. I thank you for your attention. And I hope that you guys all take with you the knowledge of public health, what you have learned, and share that with the people around you. Thank you.